Who would have ever thought that NASCA would have had a conversation around vaccine distribution? But we find ourselves right here in this time in a very, very unsettled world still, unfortunately. We know that our state chief administrators likely don't have a number one prime role in the distribution in your states. However, just some snippets here and there, we're hearing that each of you have some kind of a role. And so we really want to talk through that today. If you were with us earlier this year, you know that NASCA did a series of national briefings where we met every single Monday, had an opportunity to just kind of let our hair down, just kind of set aside some of the activities that were going on in our daily lives and just network, connect, have that opportunity to say, what is happening in your state? Oh, hey, I've had that same thing happen here. How'd you figure it out? Well, here's some things I'm thinking about. So we just want to have this conversation today, very informal, very much a round robin. I think we have about a dozen or so states on the call. We would love to hear from you again, just to share. And I want to start out with our chiefs, but we've also got several deputies and other senior leaders on the call with us, just to hear from you. What is happening around vaccine distribution? Let's start, if we can, around really, is there a distribution task force, a committee, a group? Who's leading the charge, if you will, in your states? And then we'll unpack that a little bit. And I know he's probably prepared for me to do this because I do it all the time, but our NASCA president, Dan Kim, is on the call. And I know, Dan, you were telling me California actually is working from a task force. Is that accurate?
Yes, we have a separate task force for vaccine distribution. It's being led largely by the Department of Public Health. They're taking the lead, but a lot of the procurement ends up being with our task force. My task force is for logistics and commodity movement, but I do that in conjunction with our emergency management department. And so we're taking a back seat, but we've also been asked to come up with a plan B. So in order to come up with a plan B, we need to know what the plan A is. And we're hearing that the federal government is going to be doing a lot of distribution, but the policy making as far as who gets the vaccine, that's going to be with the state health officials. But there are all these things. For example, the federal government said that they would provide fully equipped items and then mentioned that, oh, by the way, we're not going to provide any gloves. Well, nitrile gloves happen to be the hardest thing for anyone to procure right now. And then we're, like you said, the dry ice. We've gone ahead and purchased 61 different cold storage units just as backups. So always just trying to think about what we can do on our end. But I am very concerned about the distribution, how we're going to make sure that the people who get the first dose also end up getting the second dose in the time frames. Vaccines are only good for so many days in dry ice. So that'll be a challenge.
Yeah, I appreciate that, Dan. And I want to stay on the West Coast and go both to Brian and then to Tawny, but we do want to talk a little bit too this afternoon around priorities. Has your state established, a tier 1, tier 2, tier 3 for that distribution as to who will actually be receiving the initial doses? But let's hear again, staying on the West Coast. Brian DeForest, you want to share what's happening in Oregon?
Yeah, so vaccines is one of the areas that I'm probably least involved with when it comes to the COVID response. Our public health department is taking the lead. We have a working group. We call them the MAC, which is a multi-agency coordination group, again, led by public health. That's working with McKesson as our primary provider to get to distribute and get vaccines out the door. Governor's office has worked on the prioritization. As you can imagine, it's healthcare workers first and foremost. But we're also now going down to that second and third layer of prioritization. Where it's long-term care facility workers, the vulnerable populations, ensuring equity across our Black, Indigenous, people of color, populations that have traditionally been underserved when it comes to healthcare and education, and wanting to make sure, and they're also our very hardest hit populations disproportionately. And then finally, having the debate on where does education providers fall within that spectrum of priority. Um, we're working with vaccines that are not approved for 18 and under or under 18. But what about the teachers? What about the college campuses where we know that we've got people that are they're young and exposed and may not be presenting with the traditional symptoms. So we're working with all of that. Our role at Department of Admin Services is to be the backstop in case a ball gets dropped somewhere, but also to provide the governor with that voice that says, here's the enterprise view of what's going on, so that we don't focus on single voices or single populations, but rather give that broad spectrum critique, if you will, to make sure that we're being as fair and equitable as possible.
That's very helpful.
Oh, and the other challenge, and I know that Dan's going to have this, and Tani's going to have the exact same thing. Geographic areas that are remote, that do not have cryo generators anywhere close. So we've got vast populations out there that are more than 4 hours drive away, and that becomes very tricky.
Definitely an issue that all states are going to have to consider. Tani, I know you and I spoke quickly about this, and you're not directly involved, but you do still have a small role. You want to share what's going on in Utah?
Sure. Ours is being run through a task force out of the Emergency Operations Center. So mostly headed by Public Safety and the Department of Health. So I don't know a whole lot other than when they involve our procurement office. But our director of procurement told me that we'll be getting our shipment of Pfizer inoculations, and that the first group that they're going to go to are the hospitals, because they have the ability to store them at the temperature that they need to. So that's where the first distribution will go to. And then after that, they will come into our warehouse, and they'll be transported out to the local health departments with the dry ice through our alcohol beverage control trucking system. We're a very controlled alcohol beverage control state, and all the alcohol has to go through our DABC before it can go out to the liquor stores. And so they are going to use that trucking infrastructure to deliver the inoculations or the vaccines out to the local health departments with the dry ice. So because they weren't ready to deal with the keeping it cold out in the local areas yet, that's not going to be where the first doses go.
Yeah, interesting. Thank you, Tani. Kurt, what about out on your islands in Hawaii?
While we're waiting for Kurt, could I just say how I love the idea of the state of Utah using boost trucks to distribute vaccines? Tani, that is just brilliant. Absolutely brilliant.
Yeah, well, Kurt, it looks like Kurt may not be with us to speak right at the moment, but how about in Tennessee? We both got Christy and John still with us. What's the plan, task force, committee? How are you all rolling?
Our health department is managing everything. We are helping with procuring management software for our chief procurement office is getting the software to help manage the distribution. So we're actually bringing in a consultant to help with how we distribute and where this goes when. So they're really going to be the ones who take charge of this.
Very, very helpful. Thank you, Christy.
Yeah.
Yes.
This is Tani again. Christy just reminded me that it's my understanding that the state of Utah is also going to have a vendor. I had heard Salesforce, but I've been unable to confirm that to help track the distribution, but we'll be doing something similar.
Mm-hmm.
Pam, if I can jump in here, I think the distribution question is really fascinating. Drawing on friends in the British government as they rolled out today their system was turned upside down almost overnight because the ethics panel said that the vaccine should go to care homes first, should go to the elderly. And it was all about the packaging that Pfizer was, not just the temperature, but the packages, was that they couldn't disperse them in small enough amounts that the care homes could physically take them. And so they flipped to prioritize now hospitals. So that was the priority today, but still haven't, back to Tony, your point about consultants and distribution models, still haven't worked out how to package the minus 70 degrees packages in small enough packages to actually make it to the care and nursing homes. And there's no solution for that right now. And so they're actually it looks like they're going to run out of healthcare workers before they've solved for that. So let's be ready for that platform. And in terms of that distribution, the UK is approximately the size of Michigan and also having problems with the rural areas. I can't imagine how that then compares to a state the size of Utah or New Mexico, Washington, and the like. So I suspect it's coming your way at some point. Oh, one other observation too is dry ice may be the new toilet paper for packaging, and that the intelligence agencies and Europol are now focused upon organized crime gangs dealing in dry ice. So not just the vaccines themselves, but dry ice as being a crime commodity for being able to get hold of. So any of you working in the underworld, that's where you need to focus on next, apparently.
All right, thank you, Scott, for putting all of our chiefs on the black market. No worries.
I was just filling to find out our representative from Hawaii, but it looks like we've lost him. We've lost Kurt.
I think we have, but I do know that Colorado, Nevada, Indiana, and Missouri are also on the call. So Tobin, Alan, either one of you want to share what's happening in your states?
I apologize. DPA is not really involved in, similar to some of the other states, we're not directly involved in the distribution of this. We do have obviously our Department of Public Safety, Homeland Security Group, and Public Health and Environment really heading up that effort across our state.
Thanks, Tobin. Alan, what about in Nevada? Anything you want to share or can share?
Unfortunately, I am not involved in that part of what's happening with the state. I know HHS are in it. I spoke with one of their CIOs this morning, but we unfortunately are not involved in that at the moment.
Okay, all right. Still helpful though to know really where things are moving in your state. What about John or Crystal, Indiana, Missouri, or any others on the call that would like to at least address this issue of really where things are spearheaded? Is there a task force, a committee, a group? Is it landing in HHS? Others on the call who would like to share?
Yeah, this is Crystal from Missouri. We have the task force headed up from the governor's office, and it looks like we are set to get doses this month, and those will be prioritized to our healthcare workers.
Can I ask a question of whether people expect this to be on their plate? One thing I'm struggling with mathematically is the struggle we had to stand up testing centers, which is obviously a fraction of the population because it's only those who are suspected as having a case. And obviously we struggled with that in terms of making physical real estate available and the people to staff it. Maybe it's not an appropriate question to ask, but do you feel that health departments are ready for something of this scale when we're talking about immunizing huge tranches of the population? Should this be something we should all be preparing for, or do we think the current setup is sufficient?
This is Dan. I know in California, the goal is that we would use a regular hospitals or pharmacies, ideally for the general population. I think that's going to be very, very challenging. I was part of H1N1 as someone trying to get my kids inoculated. We had lines outside in high schools for hours and hours. And that was when it wasn't nearly as infectious as COVID. So to have those kind of lines out the door in the wintertime with people with face masks is probably not going to be realistic. I anticipate there's going to have to be massive logistical effort with taking over fairgrounds, with cars, security, maybe the National Guard. I think it's going to be a real challenge. And I don't think folks have really gotten to that stage yet because we only anticipate getting enough vaccines for the medical workers and the skilled nursing facilities between now and, let's say, the end of January. But after that is where I think a lot of us are going to come into play.
But others, same thing. I know I can just share here in Kentucky, we're expecting to get about 67,000 doses targeted skilled nursing, and then the hospitals. It's been interesting because the first responders are almost having a mini revolt here in our state, saying, well, what about us? We're the ones who are, taking them from the home on a gurney over to the hospital. We're dealing with this every single day, and we need to be bumped up in the priority list. So, not only I think are we concerned about not only the pure distribution, but really which populations get that priority. Or any of your other states having that similar conversation, or other groups saying, hey, we want to be bumped up in line? See some head nods, but anyone want to share, is that almost let's let the governor's office work through that? Just love to hear your observations around that.
This is Dan. Yes, that's a real issue. I think they said that the next priority is kind of essential workers, but we don't know who essential is. And that's tens of millions of people potentially. And I know the teachers are right up there. But then also, if we give the teachers the vaccines, but they don't open up the schools, so I think there are going to be some like potential nudges where if you do this, then we can give you the vaccine sooner rather than later. But I think it's going to be very controversial. And you're right. I think this is a larger policy discussion at the governor's offices.
Brian, I saw you on mute there. Is that the signal you have a comment?
Yeah, I think all states are still struggling with, kind of that economic recovery, especially in the restaurant and service industries, where that's where our heaviest unemployment is right now, and trying to get those economies kick-started again. A lot of different industries are claiming we are essential. To Dan's point, we're essential to the economy. We're essential to the safety, and so on. So it's a tough struggle. We just let the governor and the legislators be part of that conversation, and then we can try to make some informed policy decisions from there. I remember back, to kind of what Dan said when it came to vaccine distributions. I remember back at Legionnaire's disease back in 75, 76, and trying to utilize not just healthcare facilities, but school buildings and whatnot. This one's going to be a little bit tougher because of the conditions that the vaccines have to remain under. That half-life for the vaccine is rather short compared to what a regular flu vaccine is. And I pressed my procurement officer this morning saying, are you sure that the health department knows what they're doing? And there's a lot of trust going on. And I just hope that we all make it through.
Brian, it's probably easier for me to say this, given that you're all state officers, and this is a recorded call. But being in a state capital over here, there's definitely chatter amongst first responders, which is, okay, it's great. So the hospital system is designed to move drugs, but this vaccine isn't actually complicated to deliver at all. The actual delivery of the vaccine, shipping it to a location is. And if we use McKesson, for instance, which is extremely effective at getting product to healthcare environments, but may not be as effective in getting to gymnasiums, or you talked about using fairgrounds as locations during the forest fires. And so I think you're all hinting at maybe be ready with a backup plan for when your governors ask for it. And it may just be in the back pocket for how to scale these things.
This is Tawny. I think that's why Utah was looking at having them delivered to the local health departments to kind of push that responsibility of, if you want it at your local fairground or, community center, whatever, we'll get it to you, but then your responsibility is for your local.
Yeah. Yeah.
Hey, Scott, we've had an excellent question to come in around, this is more, thinking a little bit more forward, but as we get to more wide scale and widespread distribution to what we'll just call the typical population, we are hearing that there are some side effects, especially from the Pfizer drug. It's a two-step process. We're hearing that there's quite a bit of, headaches and some discomfort, and they're actually having to encourage folks to take the second dose, to take the booster. So are you all thinking about what this might do to your workforce? If we have wide scale sick days starting to come into play, is that something that anyone has considered or needs to consider?
This is Tawny. I think we've got a lot of people that are teleworking even when they're sick. So I would anticipate, unless they are debilitated from being able to work, that we'll still have a lot of them that will continue working from home.
Good point.
Okay, Alan Cunningham here from Nevada.
We've also had questions whether we're going to mandate people to take the vaccine, and at this point in time, we don't anticipate we'll mandate anyone of our state workers to do that. And to Tani's point, a lot of people are working at home or taking what we call administrative time off, and our governors have basically permitted that with the stay-at-home orders right now.
Alan, I think you had a point to make. You're a little quiet on audio, so if you could speak up.
Yeah, I apologize for that. This HP laptop, the microphone isn't great on it. The one thing that we've had added on top of this is, due to the budget reductions, we're being forced to take 48 hours of furlough per employee sometime between January 1st and July 1st. So this is really going to hit us, especially on help desk and doing calls, because it's really difficult running a 24/7, 365 shop. When you add this on top of it, add the vaccines and everything else, we're just running out of staff.
Yeah, and as it relates to that second shot as well, there's been the suggestion that we almost might be contract tracing with those who've had the first shot to encourage and cajole to go get the second shot, which of course is critical to its deployment. Dan, with regard to making it mandatory, there's up in DC, there's been chatter around actually tying economic social benefits to vaccination, so paying people to take the vaccination in some kind of form. I doubt that's going to get legs in Congress and DC, but it's an interesting notion about how do we push people sort of over the line to actually get it done. Okay.
Yeah, I think, Jamie, did you have a point you'd like to share and get some feedback on before we wrap up this afternoon?
Yeah, I'm not sure. We are in a room sharing computers here. The question is more of a leadership question. You guys, how will you communicate with your own staff, your own teams? Will they be prioritized? This is more of a leadership conversation of not necessarily how it gets to the public, but how you communicate with your own teams, wherever and whenever that falls in line. And maybe so.
Leave it to Jamie to ask the hard questions. Holy cow.
Or early, I see Brian.
Brian, it's CAO first, right? Then the governor, and then after that.
Well, not quite. I guess I hadn't even really thought of that. And so I really appreciate the fact that you brought it up. I've got an amalgam of staff that, we can work remotely. So we keep them remote for as absolute long as possible. I've got a second group of staff that cannot work remotely at all. So, and they're out in the fleet, they're custodial, HVAC, building folks. And so, for me, those are essential staff that have to show up to work. And then I've got this group that kind of flows in between each of them, and those are the medically fragile. And so, how do you put all of these kind of things together? And so it's really tough. And I'm really glad you asked. And I'm going to bring that up with my executive team this afternoon.
All right, well, Scott, we've got one more question before we wrap up today. This is more about the distribution and the workforce, meaning, do we have the capacity? Are our states prepared with the resources to continue to administer the first dose when then people start showing up for the second dose? So it's almost like we're stacking individuals that need to come in for additional doses. Do we have the manpower to do that? Has anyone even gone there yet, thinking about dose number 2?
And just to further complicate things, there are different types of vaccines. So making sure that one person, gets both Pfizer ones versus one Pfizer and one Moderna. That's where I think we're using the Salesforce system, the CRM, but integrating the data sets is going to be really, really important. At the same time, this is HIPAA protected information. So I'm not sure exactly how that's working out. I think the Health and Human Services Agency is taking the lead on it, but I think that's going to be critical, following the data, tracking that.
Anybody else at that point just yet? Have you begun to think through what the next steps might look like? All right, well, I do know that there are certainly a lot of more unanswered questions than there are answered at this point. So we are excited to continue the conversation. We are going to wrap up today, but I do want to invite you to NASCA's conversation next Tuesday. You're going to be getting some email information. We've got a registration ready to go live as soon as we wrap up this afternoon, but we are thrilled to be working with McKinsey & Company to present some information and continued information and discussion around their vaccine distribution conversation. So next Tuesday, December 15th, 1 p.m. Eastern time, we'll be shooting you some information, again, just to continue this conversation, thinking through more about the process, more systematic conversations and discussions. So we look forward to having you with us for that. Well, this wraps up the December Winter Thought Leadership Series. We are so thrilled to have had you with us now for 6 days. We'll be back together in January to unpack our learning labs more with our corporate sponsors, along with our state micro reviews and their teams coming on live to discuss as well. I do want to kick over to our NASCA president to wrap us up this afternoon. Dan, any closing thoughts you would like to share with this group before we conclude for the holidays?
Putting me on the spot, Pam.
I did.
Yeah.
I'm getting good at that, Dan.
Well, I just want to thank Pam and Jamie and Kayla and the entire NASCA team for setting up all these sessions, and Scott and team on the Envoy team. Really, these have been really helpful. They've spurred a lot of discussion, gotten a lot of us thinking, and really connected us as well. So thank you for that. I've just really enjoyed these, and I'm just very happy with how these have gone. I hope we continue to have these types of discussions, and just putting a face to a name and connecting is just so important for us to be able to do that. I know I do that a lot offline, and I'm sure you do too, but I don't think I would be able to do that as much if it weren't for these types of sessions, making me feel more comfortable in doing so. So I hope you all have a happy holidays, and we'll see you soon.
Thank you, Dan. From the entire NASCA team, happy holidays, guys. We'll see you in January.